Good evening, everybody, and welcome to our webinar series tonight, Osteoarthritis Care and Regenerative Medicine, Hope Without Height. I'm your moderator this evening. My name is Chrissy Livergood. I do a number of things here with the Arthritis Foundation. I'm a volunteer Connect Group facilitator, and I also work as an ambassador, which is kind of sharing my story with our lawmakers so they know what's going on in the arthritis community and sort of advocate for our needs. I'm also a writer and fundraiser this year's 25th anniversary California Coast Classic. It's an 8-day, 525-mile bike ride where we raise money to support Arthritis Foundation research and programs they support. I am also an osteoarthritis and rheumatoid arthritis patient. And when I'm not spending lots of time working with the Arthritis Foundation, I like to cook. I really like taking landscape photography. And because we're on kind of a sports theme tonight, it's important for all of you to know that I am a huge fan of my alma mater, the University of Illinois, and the St. Louis Cardinals. So this evening, a few housekeeping items. All of our attendees are muted, so we can give our doctors the floor this evening. There is a Q&A function at the bottom of your screen where you can type in questions. We'll have a presentation from our doctors and then a Q&A following that. There will be a survey that you receive after the event this evening. It would be great to get your feedback so we can learn from your experience here tonight. And this webinar will be available on our YouTube channel and on arthritis.org in a few days. So we're going to kick things off tonight with some audience participation. And we have a poll. Which of the following best describes your primary concern related to osteoarthritis? Is it pain management, loss of mobility and function, slowing disease progression, exploring regenerative treatment options, or understanding lifestyle changes? Go ahead and pick which one best describes what you're interested in. All right. It looks like we have a tie between loss of mobility and function and exploring regenerative treatment options, but very close behind, we've got people interested in pain management and slowing disease progression, and a healthy chunk of our audience wanting to understand lifestyle changes. So thank you for your participation. Good news is we're going to be covering a little bit of all of these tonight. So a few learning objectives. First, we want to understand the current landscape of osteoarthritis treatments. We want to examine emerging regenerative medicine therapies. We'll talk about differentiating between evidence-based treatments and unproven claims. And we'll learn to make informed choices about osteoarthritis care and some key facts. So who's going to tell us about these learning objectives? We have two wonderful doctors joining us tonight. We have Dr. James Voos, the head team physician for the Cleveland Browns and chair of the Department of Orthopaedic Surgery, as well as professor at the CWRU School of Medicine, affiliated with the University Hospital's Drusinsky Sports Medicine Institute, and special interests, wearable technology, injury prevention, and sports performance to advance safety and education of athletes. And Dr. Voos is a fan of the Cleveland Browns, the Kansas Jayhawks, and Kansas City sports. And we are also joined by Dr. Kelsey, who is a team physician with the Cleveland Browns as well, director of research at University Hospital's Drusinsky Sports Medicine Institute, assistant professor at CWRU School of Medicine, and a former team physician for Stanford and the San Francisco 49ers. And their specialties include finding ways to make sports safer while optimizing athlete performance. And we've got a fan of everything Cleveland sports and the Ohio State University. After our webinar tonight, if you're looking for some more information, we've got lots of resources on arthritis.org. I mentioned earlier this webinar will be available at arthritis.org webinars. We also have many podcast episodes and some other resources for healthy living at arthritis.org. And a disclaimer before we get started with the presentation. This webinar is not intended for any medical advice. This is for educational purposes only. Always make sure to talk to your own physician before making any changes to your personal care plan. And with that, I'm going to kick off to Dr. Kelsey.
Thanks, Chrissy. Thanks everyone for coming tonight, giving us a little bit of a chance to talk about osteoarthritis. And as sports surgeons, we see this all the time, whether it's with our former athletes that are their joints are now wearing out or they had some injuries growing up. And so osteoarthritis plays a huge part in our daily basis and the things that we do and the patients that we see. So we can get started with the next slide here. So some facts about osteoarthritis. Probably most of you know this. It's very common. It's the most common form of arthritis in the United States. Over 30 million patients have it. It is the leading cause of disability according to the World Health Organization. So a huge portion of people who are disabled have this or who claim, claim themselves to be disabled. And then the cost for hospital stays, medications, joint replacement procedures is hundreds of billions of dollars and growing. So some of this is good. We have treatment options for patients, and obviously some of that will cost money. And so being able to treat patients is great, but we really don't want patients in the hospital. We don't want patients having to take medications long term. So we want to try to find ways to keep people moving and active and treat their osteoarthritis with as minimal invasive treatment as possible. So a little bit about osteoarthritis, and I think one of the common misnomers about what osteoarthritis is that it is the presence of something. Really, osteoarthritis is the wearing away of the normal cartilage in the joint. And so what happens is some of the environment in the joint changes. Either that has to do with an old injury or just wear and tear over time. I usually tell patients, if any of my patients are listening tonight, they've heard me say it, is that you are getting your money's worth out of your joint. And so as the joint wears down, you start to lose some of that cartilage. The cartilage starts to get a little bit rough. So early cartilage that's healthy is very smooth and soft. So it's kind of like ice rubbing on ice that is very low friction. That's what allows us to move and glide and allow our joints to move freely. As osteoarthritis starts to break down the joint and the joint starts to get a little bit worn out, the cartilage itself gets rough. And so it becomes a little bit more sandpapery. You start to feel that kind of grinding and crunching in the joint. And what happens is that creates an environment in the knee that is painful, or whatever joint that you're experiencing it in. And that creates an inflammation in the joint, that creates swelling, that creates something we call crepitus, which is that crunching in the joint. What causes it? And it usually is that sort of wear and tear, but it can be after an injury. Say you had an injury when you were younger, tore an ACL, or had an injury where you dislocated your shoulder. That injury causes some damage at a cellular level to your cartilage. And so it's not always something that can be seen on the surface, but something that over time can add up. And then that cartilage starts to break down. And so that's what we see in terms of the causes of osteoarthritis. Why do people get it? It really is often because you're active. It can be other reasons too. Sometimes you're just wearing it down and you've beaten up the joints over the years. Obviously, we know that if you're overweight, the more forces that go across the joint, the more likely you are to wear down the joint. And so that's one of the reasons why if you're a little bit overweight or obese, will it go away? Typically, no. So what we want to do is we have treatment options that can hopefully help to slow it down or even stalemate the progression of it, but we can't really make it go away at this point. We don't have great options that can reverse the treatment, or that can reverse the disease course. But the treatments that we have currently, what we want to try to do is slow it down. We want to prevent the osteoarthritis from getting worse, and we want to maximize your ability to have a good functioning joint for as long as possible. One of the other things too is that you can have genetic causes. I can go back one slide real quick. Sorry. So the other causes that can lead to osteoarthritis, there's definitely some genetic makeup that may predispose certain people to osteoarthritis. Or you have loose joints that might make you more likely you're going to wear down your joint. Your cartilage itself can have more risk of injury, and so we definitely know that there are some genetic components that can cause it. So this helps us to essentially create our treatment targets as we're formulating different treatment plans for patients. Go ahead to the next slide. So Current treatment options, and this is really kind of the basic look at what we have. We can talk about weight management. I talk about it with every one of my patients. It can often be a hard conversation to have, but I think most patients appreciate it. And so always having that very straightforward conversation with the patient about weight management, how important that is to the health of their joint long term, especially if they're trying to recover from an injury. Medications, we definitely have medications that can address some of the symptoms related to osteoarthritis. You'll hear about some other medications out there that maybe help the health of the cartilage, help the health of the joint. Those are out there. They have mixed data to support them. I usually tell most patients that it doesn't really hurt you as long as it's safe. It might hurt your wallet or cost you money, but it often is. These are often safe for the joint. Physical activity is very important. So not only does that help with weight management, that helps with the strength of your muscles, that helps the cartilage itself as it responds to the movement and it responds to the joint motion. That's how cartilage gets its nutrients and can heal. And then obviously we have surgical options, which we try to minimize if we can, but if a patient gets to a point where they need surgery, there's surgical options available. So weight management. So as we get older, it's really hard to overcome poor diet with exercise. And so exercise is good for cardiovascular reasons. It's really good for your muscles and for your joints. It's not necessarily the greatest thing for weight management. Although it is really good to stay mobile, the best way to control your weight or to improve your weight loss is really having a good healthy diet, and the preventative measures that you can take early on are best. So if you can prevent yourself from getting to a point where you really are overweight, obviously if you are overweight, there's really good diet options where it's sort of a healthy and colorful diet where you want to eat a wide range of fruits and vegetables, whole grains, lean proteins. These are things that we've known since we were kids when we looked at the food pyramid, but oftentimes we kind of forget the way that we want to approach this, and it really is about having a well-rounded diet with as much of the sort of colorful fruits and vegetables as you can. Increased water intake is really good. So there's a couple things that water will do. One, water is obviously good for our muscles and our joints and to keep us hydrated. It fills you up. So if you drink water before you eat, you might not feel as hungry, which means you might eat less calories during a meal. So not a bad idea as you increase your water intake. And then you really want to limit sugary foods and saturated fats. The sugary foods, the sodas, the juices, those are the things that we want to sort of decrease as much as possible. A couple things that'll increase your glycemic index, that puts you at risk of diabetes, that makes it so that your body doesn't process sugars as well if it starts to wear down. And really a lot of those things are in our sugary drinks. So if in sugary drinks, if we can decrease those, that's a really easy way to cut down on calories and the amount of sugar that we intake. Saturated fats is another way that we can help to decrease or control our weight management. It's also really good for your heart and your cardiovascular system. So really just trying to limit the intake of those things and not necessarily cut them out entirely, because that's very challenging in the current landscape, but really trying to minimize them. So there are medications available, and we don't want to manage chronic problems with medications if we don't have to, but for short periods of time, they can manage your symptoms of osteoarthritis. Again, but they should be used with these other lifestyle strategies. So medications alone, while some of these anti-inflammatories can be very helpful at decreasing the inflammation that you have in your joint, it's not going to reverse the arthritis. It's not going to help with your weight management necessarily. Really, all these things that are going to help you long term and that aren't always quick fixes are best. But I always tell patients, if it helps you to be motivated to eat better, if it helps you to be more mobile, if you're able to get into physical therapy and do the physical therapy and get your muscles strong, all those things really help. And so if taking some anti-inflammatories, if taking Tylenol or the acetaminophen, if those things help you to stay mobile for a short period of time, that's a great option. There are prescriptions that you can discuss with your doctor. There are injectable options, so the corticosteroids or hyaluronic acid. So corticosteroid is a strong anti-inflammatory that can be injected in. Obviously not a long-term solution, but can be something that provides patients with some relief for a short period of time so that they can become more active and get back on their feet. The hyaluronic acid is an interesting option because it has both lubricant and anti-inflammatory properties. So as I discussed before, as your joint starts to wear down, the joint surface gets rougher. And so as that sandpaper is sort of rubbing on itself, that hyaluronic acid injection can act as a natural lubricant to help things glide a little bit smoother. And then it also has some anti-inflammatory properties to help the joint be a little bit calmer. And then really talking with your doctor, talking with your orthopedic surgeon, talking with family members and others that have gone through this and experienced it, and then you can bring that to your doctor. Those are the things that you can think about and try. There are some topical anti-inflammatories available, things like Voltaren gel, which you'll see. There's the classic Icy Hot or Bengay. Those things are out there where they can help really to mitigate some of the symptoms, but they're not going to make the osteoarthritis go away or go in reverse. And then the really important thing, anytime you're taking a medication, is to watch for the side effects. You really want to keep an eye out for any of the side effects that are happening, particularly with these anti-inflammatories. They can be harsh on your stomach. So discussing that with your doctor, making sure it's safe for you, making sure it's appropriate is really important. So physical activity is my big go-to for a lot of my patients in terms of the health of their joint, staying active. It also is really motivating to eat better. So if you're mobile and you're moving and you feel better, it really will motivate you to eat better and make better decisions when you're going out to eat. In terms of physical activity, so moving helps with osteoarthritis. It strengthens the muscles around the joint. It helps your bones. It keeps you flexible. And the cartilage itself actually responds to motion. So low impact activities, biking, elliptical, swimming, walking, yoga, all those things are really good for the mobility of your joints and really for the long-term health of it. And we want to keep your joints functional. So a lot of patients will say, "Hey, I feel really stiff when I don't move." And if you don't move, that joint starts to flare up and get a little bit irritated. So the mobility can actually lubricate the joint, help it to feel like it's a little less painful and a little less stiff. Discussing with a physical therapist. The physical therapists are great resources for patients. They're great resources for us as physicians. Physical therapy does not always have to come after a surgery. So a huge amount of patients will attend physical therapy preemptively. So prior to a surgery, really trying to keep your muscles strong. And it's not something that you necessarily have to go to physical therapy for as long as months and months at a time or multiple times a week. Really just getting an evaluation, getting some direction, checking back in with the therapist on what you're doing. There's also lots of classes available in your community. So really look out for things that you can do to kind of stay mobile, stay active, really keep working those joints and the muscles. Again, incorporating these low impact activities. Swimming is great. It helps you feel more buoyant. So especially if you're overweight, it's a really good way to move your joints and not put a lot of impact across them. Bike, elliptical, walk, those are also really great. And I always tell patients you can turn a low impact bike ride into a high impact bike ride if you're in one of those really intense spinning classes or riding up a lot of hills. So keep that in mind, that might lead to some joint soreness if you really start to be aggressive with your bike rides. Next slide. So obviously we're surgeons, so we have a job for a reason, and osteoarthritis and injuries keep us busy. We want to prevent you from having to get to the point where you need a surgery. However, the reality is some patients get to a point where they need a surgery, and surgery can be a great option. Joint replacements are growing in this country and across the world for a reason. It's a very well-established surgery that can really improve the quality of life of patients. Even something that the old adage of you want to wait as long as possible before you get a joint replacement and wait till you're in your 70s or 80s or even longer because it's going to wear out. A lot of that has changed, and the thought behind that has changed. Our techniques have improved. The materials that we use for joint replacements have improved. So these are lasting longer and longer. We want to restore patients to a high quality of life. And if that means that your joint's totally worn out at a relatively young age, we don't want you to, you've exhausted all the other options. We don't want you to suffer for years and years with poor mobility, because that leads to other health related issues. We want to keep you mobile, and really joint replacement should be used to keep patients mobile, keep them up and active. And so when a patient does get to a point where the joint damage is so irreversibly bad, we want to make sure that we have an option for them. And joint replacement's a great one. And it's been very successful. I do them as a sports surgeon. I have a lot of patients that are very, very happy. And so just making sure that we can minimize the amount of patients that get to that point is kind of one of our goals. But if you do get to that point, there are answers. Arthroscopy, there are arthroscopic options. Typically, these are earlier in the course of disease. If you have like a focal damage to your cartilage, there's ways that we can help to restore that cartilage. We can clean up some of the loose flaps in your joint, and the classic going in and scraping out the arthritis isn't really something that we do. So again, arthritis is not the presence of something, but the absence of something. So as we're thinking about treatment options, We don't want to go take away more cartilage, but we can smooth out some of the cartilage if you're having bad mechanical symptoms because you have loose flaps in the joint. And then I don't want to forget about osteotomy. So osteotomy is actually cutting of the bone. So some patients get worse arthritis because of their alignment or the ways that their joints are aligned. So if you're very bow-legged, you might be wearing down the inside part of your joint a lot more, or if you're knock-kneed, you're wearing on the outside of your joint. Or if your kneecap alignment is off and your kneecap is riding to the side and rubbing preferentially on the outside part, the osteotomy is a really good option to prevent further progression of disease, offload that part of the joint, improve your biomechanics. But again, a big surgery, something that requires recovery, but a good option for patients who have that early arthritis and some sort of limb malalignment that can be corrected. And so now I'm going to pass it over to Dr. Voos. He's going to talk about some of the emerging therapies, some of the things that we're working on at Case Western and university hospitals, as well as some things that might be in the pipeline around the country and around the globe. But really what we want to focus on is trying to use either your own biologic options or some biologic option off the shelf to use your own joint capacity to heal. And we want to minimize as much of the non-natural ways of treating this. And so I'll pass it off to you, Dr. Voos.
Great. Thanks, Dr. Kelsey. And there are times throughout medicine where we have breakthroughs that allow us to have added ways to take care of different things. And there's different types of joint replacements that come out all the time that with improved outcomes. We have different medications we take by mouth and different injectable medications. And we're on the precipice here currently where there are quite a few breakthroughs where we are harnessing the body's own ability to reduce inflammation, improve symptoms, and hopefully either slow down or reverse the effects of osteoarthritis in our body. So we want to talk a little bit about a few of those therapies, define what those are, and help you in some of the decision making if you're seeking out these different alternative treatments. So we can go to the next slide. So when we think about regenerative medicine, it's one of those words that gets thrown around quite a bit. And when we use that term, we think about ways improving the body's ability to decrease inflammation and hopefully repairing or improving the quality of damaged tissue. And it is, as we think about regenerative medicine, it often is connected with our thought of hope of slowing down your arthritis or maybe avoiding a surgery. And the end goal of all of this is to harness the body's own ability. Really, our body knows best how to heal itself. And we really we have developed more of these options, and they're becoming closer and closer to day-to-day treatment for patients with arthritis. So we're going to share a little bit about that with you. This thought of a stem cell initially came in the 1960s, where we realized there are these core cells inside the body that have the capacity to grow into various tissues. So that's really, now that we have identified those tissues, now we want to see how they work and take advantage of them to help our bodies. So we'll on the next slide, we'll share a little bit more about each of these treatments. So stem cells, again, are those cells, those core cells in our body that have the ability to differentiate into different areas. And in the joints, we really think about a term called mesenchymal stem cells or mesenchymal stem cells. And those cells, when they differentiate, depending on how they're stimulated, they sit in our bone marrow and in our fat and in babies in the umbilical tissue. And when stimulated, those mesenchymal stem cells can turn into cartilage, they can turn into bone, or to tendon and ligament. So what we want to do is harness the power of those stem cells to assist our body. There are quite a few different basic science studies that are going on where we're really trying to see if we can make our joints healthier. And we're going to show you a couple examples of those here very quickly. We can go to our next slide, please. So here in Cleveland at University Hospitals and Case Western Reserve University, where Dr. Kelsey and I work, we're very fortunate to carry the legacy in our lab of Dr. Arnold Kaplan, who unfortunately passed away this past year. He was the first person in the world to coin the term mesenchymal stem cell, the cell that as part of our musculoskeletal tissues. So we are fortunately able to carry on his legacy, a well-established lab with a lot of knowledge at how to characterize and utilize these cells. And we've realized these cells may be a little bit more activated than we think. And so towards the end of Dr. Kaplan's life, we've changed the term of MSC to medicinal signaling cell. And we say that, and it may not just be the cell itself that's doing the work. When the cell goes into the joint or when the cell goes into whatever area it's working in, it's not only the cell itself at work, it's the signals that the cell makes, and those are called cytokines or growth factors that the cell releases. And the best analogy is to think like an anti-inflammatory liquid gel. When you swallow that liquid gel, it slowly dissolves and releases medication over time. And that's exactly what these cells do inside the body, is they release all these signals to stimulate healing and blood flow and decrease inflammation. So this term medicinal signaling cell is a little bit more accurate to how these cells are performing. So we'll go to the next slide. So one of the things we often hear about as a first-line treatment is platelet-rich plasma. And this is a very common treatment for osteoarthritis, and we use this quite frequently in the office. And one of the reasons we use it so much is it's easy to do in the office. It requires just a very simple blood draw, just like you would normally get your labs drawn. It takes just a couple minutes. And what platelet-rich plasma does is it takes your blood, we spin it down in a centrifuge, and we separate the different components in your blood. And red blood cells, while they're great for carrying oxygen to our tissues, it can be an irritant because there's iron in the red blood cells. So if it sits inside the joint, it can be irritable. So that's why we don't just want to inject whole blood into the joint. So by separating out the red blood cells, we can get the plasma and the platelet-rich layer. And those growth factors and cytokines, those are all those signals that the cells produce, live in that layer. When we inject it into the joint, it can decrease pain, decrease inflammation. And again, it's using your body's own tissue. Your body knows what it needs. So again, this is not a cure for arthritis, but it can really help manage symptoms. And it's something that's a very first-line therapy we utilize in the office. It's safe because it's your own tissue. There's no other medication added to it. It's a very simple procedure to perform. And often, while insurance does not cover many of these biologic treatments, this is one that's much more affordable compared to some of the other cell therapies. Gene therapy we hear about quite a bit, and that's going all the way to the DNA level in those cells in our body and helping to modify or change how those cells or how those genes perform to try to slow down the production of proteins that cause inflammation or degrade the joint. This is really still an experimental phase. We do see gene therapy coming up more and more in childhood and adolescent diseases, as well as in cancer. So we're learning a lot about how gene therapy works. And ultimately, there are certainly numerous institutions across the country working on these studies to see if gene therapy can assist in the use of osteoarthritis. So more to come with this, but there are not any active trials that are readily or publicly available on this currently. So there are a lot of steps still to take, but there are researchers that are diligently working on this in the osteoarthritis space. One of the things we wanted to talk about today is, it's called the Omega Project, and Omega means orchestrating multifaceted engineering for growing artificial joints. And the Omega Project is a project we developed here at University Hospitals and Case Western Reserve University in collaboration with multiple other institutions across the country. This project was submitted to a federal grant, which is called ARPA, A-R-P-A-H, which is an offshoot of the NIH. And we received a $47 million grant from the federal government for us to establish ways to grow an artificial joint. So instead of putting metal and plastic in your knee, which is very, very effective, we harness the body's ability to take your cartilage cells, grow them, and in a biologic implant, replace the surfaces of your joint in efforts to reduce your need for a metal and plastic joint replacement. So we're really excited. This study is just getting underway. It is not in human trials here yet, but our goal here in this 4-year project is to ultimately have an implant and a process for us to harness your body's own cells to create a new joint for you that can serve again as a cartilage joint replacement instead of a metal and bone joint replacement. So I present our institutions banding and teaming together, working to solve this problem, and it's been recognized by the federal government. So we really look forward to coming back to this group and sharing more about this project here in the future. And we'll give you a little bit more detail here as we move forward through the talk as well. So clinical trials really are there, and this Omega will be one of these clinical trials, and that's where we register these with the federal government. These are how we test new medical treatments, and it assures that they're safe. And we first and foremost evaluate the safety of a treatment and then the effectiveness. And these clinical trials all go through multiple phases before they're released for regular use to the public. And it starts with just small safety tests. And then we evaluate and make sure, is it effective? Are there fewer side effects? And then we start to use it on larger populations. And then once we see that it's safe and effective in large populations, then it goes into widespread use. And then we monitor it even post-utilization to make sure that this is an effective treatment. And we do this whether it's a medication, whether it's a new type of exercise, whether it's a new type of joint replacement. So these trials really help to advance science and move things forward, but we want to make sure we do it safely. So when you see the term clinical trial, that's what we're talking about. And clinicaltrials.gov is the federal government's repository that lets you see all of the clinical trials that exist in any parts of medicine. But certainly there's a section on musculoskeletal care that I encourage you, if you're interested in what studies are ongoing, is a great resource. So Omega at Case Western Reserve University, we're really excited to have this project moving forward. And we're currently in the phase of harvesting cells from procedures. We're growing those cells in the lab, and then we've created a prototype of the implant that we're now starting with some animal studies and some biomechanical studies. So really looking forward to, again, coming back and showing the group what this project looks like. And it's been a great thing for Dr. Kelsey and I to be involved with here, working with our joint replacement partners and our PhDs here to move the project forward. And I believe on the next slide shows all of our partners that are involved with this. So it's a wonderful project spearheaded at Case Western Reserve University and university hospitals, but we've partnered with multiple other large institutions across the country, other biotech companies that really are all coming together. And I think that's where the hope comes from this, and that's where the excitement comes, is all of us realize the impact that osteoarthritis has on all of us and has on the country. And we realize working together, we're much more powerful than working apart. So they've really been wonderful collaborations, and I think this has really helped us accelerate our scientific discoveries here. So I think you'll see we're in a phase where those discoveries have really taken off. So I think you'll see quite a few of these advancements coming out in the near future. Again, our goal of Omega is to our goal of the Omega project is really to grow that bone and cartilage to avoid metal and plastic total joints. So while those are great, we want to try to keep your tissue for as long as possible. Within 5 years, our goal is to have our first 40 patients complete, and then ultimately scale this to where anybody who desires to have this type of treatment has the opportunity to experience it. We can go to the next slide, please. Maybe stuck. Well, while this page, I can fill in a little bit more on the other aspects coming through with this. And when we think about stem cell treatments, which is one of our other options that we're bringing up, you'll see all over the place, there's billboards and advertisements and every type of stem cell you can imagine for different treatments. And one of the things that we feel is important with that is that you really know that it's a reputable physician who is treating you for those stem cells. We want to make sure that you know that the cost is appropriate and you know exactly what's going in your body. No matter what type of stem cell treatment you may obtain, at the end of the day, the main part of that treatment is you. It's your body and your cells. So no matter what others may claim they do with the cells or add to the cells, the core part of it is your body's own healing element. So I always caution folks, if you're going to undergo stem cell injections, which are a very reasonable thing to consider, you want it to be from a reputable physician at an appropriate cost and a place where you know exactly what's going in your body. What we have done at university hospitals and Case Western Reserve University, and I'll turn it over to Dr. Kelsey to share that with you, is really worked on a process to standardize that stem cell treatment and enhance those stem cells so that you know exactly what's going in your body. And we really want to be the voice of science and the voice of reason to really help our patients know exactly what they're getting. So I'll turn it over to Dr. Kelsey to talk about another study and another process that's going here related to stem cells.
Thanks, Dr. Bruce. Great talk on a lot of the exciting and really hopeful things that are coming through. And there's a lot of really great clinician scientists and scientists around the country and around the globe that are working on all these things. So you can rest assured at night that there are a lot of us that are racking our brains constantly trying to make this better. And so you can sleep easy. We'll keep working on our end to try to make things better for you guys. But one of the things that we're working on at Case Western and University Hospitals is we have an FDA approved clinical trial. We are the only lab in the country that has the approval to expand or grow your stem cells in a lab and then inject them back into your knee for osteoarthritis. And so the current state of the FDA is that they have a rule that says that cells can only be minimally manipulated. What that means is that the cells that we take out of your body can only be very minimally manipulated, meaning they can't be grown in a lab, they can't be, different things can't be added to them, or at least for them to be FDA approved, that is the case. And so you may hear of different things happening, as Dr. Voos mentioned, and I'll be very careful and sort of approach with caution if a doctor or otherwise is selling you on a stem cell treatment that may fall outside of that purview. And so on our end, what we are able to do is we actually can grow your cells in the lab. The current treatment option prior to this was that all we would do is we could take your stem cells and concentrate them down by spinning them in a centrifuge. So similar to how we prepare the PRP, we just take the cells out of a different part of your body, whether it's from your iliac crest or your pelvis bone, or really anywhere else in your body where there's bone marrow. So bone marrow is where all the stem cells live, or at least where a good portion of them live. And that those can be harvested and then spun down. The current way, you only get a few thousand stem cells per injection. In our study, as we expand them in the lab, so we take the cells out of your pelvis, we send them to the lab. We grow them, so we clean them and purify them, we sort them, and then we grow them into the 50 million cells are then injected back into your joint. So instead of a few thousand, it's a very concentrated, high volume of sort of mature cells. These are your own MSCs. And what we found so far is that patients do quite well. So we had a 16 patient safety and efficacy study to start. So we have completed that. We have enrolled all patients. And all patients have received the treatment. So far, no major adverse events. Some patients will get a little bit of inflammation after the injection, which is not surprising when you're getting 50 million stem cells injected in. We've had a 60% improvement in pain symptoms at both 6 months and 1 year. This is just at one single injection. 15% improvement in functional scoring at 6 months and a year. And most patients just say they're doing more things that they hadn't been doing for a long time. And that's a really nice thing to hear as a doctor and as a surgeon. Often we can't get these results with our surgery patients. So it's really nice to be able to get it with something non-surgical. And what we found is that all patients that have a 1-year MRI so far have shown reduced bone marrow edema and no advanced disease progression. So what you see here are pictures of a few of the first MRIs that were done. So the first 3 patients stacked on top of each other there. And the white is actually edema in the bone. So on these scans, edema in the bone is actually very painful. The edema in the bone, which is essentially bruising of the bone, happens because of the irritation related to the osteoarthritis. And really that's one of the more painful things that happens in the osteoarthritis progression. So if we can decrease the edema, we can decrease the symptoms, we can slow the progression of disease or the cartilage wear. And so far that's what we found. And we've had really good results. Patients are very happy. So we've gotten these first 16 through. We're currently submitting for our phase 2 trial. So there really is a lot of hope out there. There are ways that we can treat this and sort of prevent these things. And so what we want to do is we want to make sure that we can get patients moving and get them back as quickly as we can. One of the questions in the panel here is that if techniques have improved, why is patient satisfaction after knee replacement so relatively low? We can talk about that in a second, but to finish up the stem cell study, this is these are things that are going to become available to patients, we hope. And so if we can get the second phase of the study through, we can help patients at more of a national scale. And currently this is just for study patients, just with some narrow indications and parameters, but we really hope to be able to commercialize this and get it out to patients to help them get back to the things that they want to do. I will answer the question on the knee replacement still relatively low. So knee replacement is a challenging thing, not technically necessarily, but it is a challenging thing to recover from. If any of you have gone through a knee replacement out there in the audience, you know it requires a lot of work. The knee loves to get stiff. And so what we want to do is we want to keep patients moving, but we still have not been able to get past. There's about a 15% of patients that just don't love their knee replacement. We're trying to figure out why. Their x-rays look good, they functionally look good, but they just don't feel great. So there's definitely ongoing research with some of our joint replacement colleagues to help that. And I'll tell you what our goal is that we want to get you to a point where you don't need a knee replacement. We want to keep you moving. We want to keep your joint healthy and happy. We want to try to intervene earlier before it gets to a point where it's worn down and needs a replacement, needs those parts to be swapped out. We want you to keep your own stuff that you were born with as long as possible and really try to keep you healthy and mobile. I'm going to pass it back to Dr. Voos so you can talk about what the future holds, give you guys a little bit of hope for what's out there. But again, thanks for having us, and I'll be back for the Q&A part. Dr. Voos, you are muted.
The nice part with the future treatment is there really are new options coming along. Every month we continue to have breakthroughs. Our collaborative groups continue to work together. There's a lot of attention on this at our basic science level, and both when you look at the sports medicine world and rheumatology and physical medicine and rehabilitation and our joint replacement doctors, all of us are working together. We understand the burden that that osteoarthritis and arthritis has on us and our overall function. So it's really gained attention. It's really moved a lot of labs and research groups to work on this. So fortunately, it's gained attention. And as a result, we've really been able to move our studies forward. So we really look forward to further options moving forward. I think you'll see that in the coming months and years, more and more options will continue to come into play. Our surgical management, now that we can biologically augment or manipulate tissues or using your own tissue, is continuing to grow. And then, as Dr. Kelsey mentioned, even things like our joint replacement, we want to continue to improve how you have your joint replacement, the shapes of those implants, how we do your pain management afterwards to continue to make that process work really well. And then we're understanding more and more as we have opportunities to do larger clinical trials of what exercise really does. What does weight loss do? What are a lot of the supplements that are out on the market? Do supplements have a natural anti-inflammatory effect? Do they help your body's immune system? Do they spurn your body to heal what's going on? So I think there's more and more data that shows that, or more and more opportunities to give us very clear data as to how each of these things work. And I think the main thing with this is to have a plan, because you can come in and want to do everything at once. I'm going to exercise and I'm going to have this injection and I'm going to use these supplements, and it can be a little bit overwhelming. So I do think it's good to have a partner in this, and whether it's your physician or a physical therapist or a nutritionist, to work with you. And that way you have someone that's your teammate to help quarterback this with you, to walk through, okay, we're going to start to layer in this approach. And do I have my diet, my exercise, and am I wearing the right shoes? And is my environment safe and appropriate for me to protect my joints? And then start adding in those other layers. What medical is supplement or medication? And then is there an injection or one of these biologic treatments? And then ultimately a joint replacement. So I think it helps to map out a little bit of a plan and have a little bit of a roadmap, because it can feel a little overwhelming with all of these options coming at you. So having that thought process of, okay, what's the next step and what's ahead? And if this works, great, we'll stop here. And if it doesn't work, what's next? But I think it kind of helps to have that roadmap. That way it doesn't feel like with each progression, or if one treatment doesn't work, that we're out trying to search for the next. I think putting together that broader plan is really helpful. And I think it helps you move forward with some purpose with the treatment. That way you really know that someone's looking out.
Well, thank you both, Dr. Voos and Dr. Kelsey, for that, to me, really exciting overview of some of the things on the horizon. And I have to say, Dr. Voos, what a perfect segue to the next section. We have kind of a pre-made Q&A for the doctors, and then we'll answer some of the attendees' questions towards the end as well. But to kick off our first set of questions, we've got this teed up for Dr. Kelsey, but feel free to either one of you jump in. Like I said, perfect segue into sort of the overwhelm of a diagnosis. I know I got my first OA diagnosis about 6 years ago, but I got a second one about 2 weeks ago. And I'll have to say that even though I've been managing one for a long time, the new diagnosis, just what you were saying, it kind of brings up a new, like, well, should I try a different approach this time? There's so many pieces and it can be very overwhelming. We've talked about a lot of things today: weight management, nutrition, physical activity, medication, supplements. Kind of where does someone start? There's so much to put together. How do you find your team? How do you find the people helping you? Are those some like strategies or resources you would recommend for juggling all of this? And then once you have the plan in place, I know it can be really hard to stay motivated. You're gung-ho on all these things that you want to try, but it can be really difficult to stick with, especially things like the nutritional aspect or staying physically active. And then maybe if you could offer some of the things that you yourselves personally do that maybe some of us could take as inspiration and motivation to keep going.
First of all, I'll put a totally unsolicited plug in here for your local Arthritis Foundation chapter, as well as the Arthritis Foundation website. There's tons of information, and there's really a lot of resources out there that can help you from start to finish. It can help you to build your team. It can help you to have an idea of how to build a plan. Doing it with a teammate is often really helpful. Having either a partner or a friend or someone else that's going to go through the journey with you is really important. Being able to sort of connect with a group of individuals can make a huge difference, and it can really make you feel like you're not so alone. It's not so challenging. There's a ton of these Facebook groups out there and other ways that people can connect, and I have a lot of my patients that are part of these groups as either they're rehabbing from a surgery or dealing with an injury. So these are all ways to kind of keep yourself motivated and keep moving. Really try to not do it alone. I think that's the biggest thing to start. And then really, it doesn't have to be perfect. You don't have to be perfect with your plan. I think really just trying to stick to some sort of a plan, some sort of a forward moving momentum is really important. Trying to keep yourself excited about it and motivated. The nice thing about weight loss or mobility, it really tends to improve as you go. So you feel better as you lose more weight. You feel better as you become more active. And so that alone is very motivating. And often they feed off each other. So if you're eating well, you want to be more active. If you are more active, you want to eat better. And those things are all very helpful. And really not getting down on yourself or discouraged if you don't execute your plan perfectly. And for me, and Dr. Voos can attest, our job as orthopedic surgeons is very physical. Doing a knee replacement can be a very physical and challenging thing. Really, throughout the day, we'll do 6 or 8 surgeries, and we're pretty physically beat up at the end of the day. So taking good care of our bodies, eating well, really trying to get appropriate sleep is very important. So your body heals at night when you're sleeping. So that's another way to really protect yourself. Minimizing alcohol intake and things like that are really helpful in terms of keeping the inflammation down in your body. So all of those sort of multimodal attack to really help to keep your body in as tip-top shape as possible.
And if I could add with Dr. Kelsey, one of the other things we think about is from a team or a strategy is because you refer you to a physician, or you may finally have the energy or the desire to go and talk with somebody about it, and it may not have gone the way you wanted to, or gotten the advice you wanted to get. And don't be discouraged with that. I do encourage you to find another outlet, whether it's a physical therapist or going to another doc or asking for another opinion. That's okay to do. And hopefully the first time it's the right person, and you find a person that is willing to work with you and go through that information. But if you don't find the right person the first time, I want to encourage you to seek out additional opportunities and additional avenues. There are a lot of physicians out there and other healthcare providers that are really well versed on this now, where it used to be very few people kind of knew about the stem cells and some of these other treatments. So now it's much more commonplace. So I encourage you to, if it didn't work out with the first person you visited, to keep trying and to ask your primary doc for those referrals. Who's the trusted person in your community? That way you can make sure. Sometimes it takes a little bit to find the right person that you have the right connection with.
Great, thank you so much. And then, like I said, we've got this kind of directed at Dr. Voos, but both of you feel free to chime in. A few more questions. So if my osteoarthritis is currently well managed, would I benefit from seeking out one of these emerging treatments, some regenerative medicine. How would I know what these treatments might be, or how do I become a patient in a trial? And I know this is a little maybe tricky question, but I guess very generally speaking, are these kinds of treatments and emerging therapies typically covered by any insurance, or are these more like an out-of-pocket experience?
Those are all great questions and ones that come up quite frequently. And the first question, if your arthritis is well managed, if you have good motion and your swelling's down and your pain is at a minimum, we want to try to keep going with what's working. To keep going with what's working. And we often get the question, should I prophylactically do something? I know I have a little early arthritis where I've had symptoms in the past. Should I go ahead and get this to try to ward off symptoms? And at this point, we know our regenerative medicine treatment work best in treating and managing symptoms and managing pain or swelling or aching. So at this point, I would recommend or suggest to utilize those treatments when you're having symptoms or for symptoms instead of being in a prophylactic setting. There haven't been enough studies to show if doing things ahead of time has made a difference. So in terms of managing your resources and the risks of the treatments, I would utilize the regenerative medicine treatments for when you're actively having symptoms and when other frontline treatments have failed. Many of the clinical trials, most of the clinical trials that are out there are listed on clinicaltrials.gov, which are the vast majority are registered. If you do have an academic medical center in your area, or again, a rheumatologist or a sports medicine physician or a total joint doc, most of those physicians either know the trials or can point you in the right direction. And I know the Arthritis Foundation does a wonderful job of knowing which of the broad they're available. And unfortunately, this is our biggest challenge with our biologic treatments currently, is they are typically not covered by insurance. So most of these are out-of-pocket treatments. And why that is these treatments are newer, and there have not been those large-scale studies. We talked about those clinical trials up front of having those multi-phase trials with thousands and hundreds of thousands of patients that show the efficacy of treatment, and it really takes that before insurance starts paying for these. And one of our challenges with stem cells, and you'll see this locally in your town, is there may be one person who's using fat and one person who's using your stem cells and one person who shakes up the cells and another person who does something else to them. So a lot of the studies have not been uniform. There's all of these different formulations out there. And so what we're trying to do, as Dr. Kelsey had presented, is have some uniform studies that show exactly what you're getting, the exact number of cells, so that we can show with a very standardized treatment, it has the opportunity to help you. So we're trying to move the ball forward here in that opportunity to show that this is efficacious, so it ultimately can be covered by insurance. But at this point, it's out of pocket. And that's where I really recommend. There are folks that if it seems like it's a lot of money, they're probably charging too much money. So I would talk in a very practical aspect. I would talk to multiple folks in your community about who's the reputable person. And it's okay to get a couple opinions and see what's out there and see what people are charging and feel what you're comfortable with. And at the end of the day, I tell people, if you have those resources to utilize, if it helps, it's the best money you've ever spent. If it doesn't help, it's understandably frustrating. So the core is to utilize those frontline treatments first. Do your research in your market to find out who the reputable person is that's performing this. And I will tell you, most of the reputable people are not the people charging the most for the stem cell treatments. So that's for whatever that's worth to the larger group as you're seeking out care. That's just the advice from Dr. Kelsey.
Fantastic. Thanks for answering that first question. So we've heard a lot already this evening about kind of managing this OA diagnosis. So now what? What are some resources that are available? So no one can tackle OA alone. This is definitely a lesson I've had to learn as a patient. And we've touched on several times already this evening, really taking a collective or team approach to address some of the challenges. So your healthcare providers to handle, the scientific diagnosis and treatments and some guidance, and collaborating with other healthcare professionals. Us patients are part of that team, participating in the care plan that your healthcare provider lays out, staying informed. I had to do a lot of self-education with my diagnoses, and then advocating for our own needs as patients is really important. And then our support system. So our families, our friends, our caregivers are very important, and really finding a community that can help you. I know I've had lots of very good days and some really bad days, and having that full community to really help support you through those times and through any kind of diagnosis really is important. Speaking of community, there are quite a few ways to find that within the Arthritis Foundation. I mentioned at the beginning, I'm a facilitator for a couple of our Connect groups. These are support and education groups. I work with the Greater Los Angeles area group, as well as a brand new group as of like a couple of days ago. We have one for people who are interested in cycling. So we have groups that are based on location, different interests, and then kind of like different diagnoses. Can we go back a slide real quick? Oh yeah, we have some in-person events. There are events like Jingle Bell Run and Walk to Cure Arthritis. We have the California Coast Classic, which is another in-person event, as well as the Carolina Hills ride this spring. And then we have webinars like this. So lots of opportunities to come together with other people who are sharing some challenges of an arthritis diagnosis. I know I mentioned the California Coast Classic and the Carolina Hills ride. Those are part of the Arthritis Foundation cycling experience. So if you are interested in something that might help your OA, I personally have been honestly floored at the improvement in my joint health since I started training for the California Coast Classic. Having low impact activity schedule I have to follow has really improved some of my knee symptoms. But we have the California Coast Classic this fall in September, the Carolina Hills in June, and then you can ride on your own. If you can't make one of these big events, you can do your own cycling event and do some fundraising. Again, money going to supporting those community events and funding some research like things we've heard about tonight. And then, like I mentioned, Connect groups. When I first was diagnosed, the very first thing I did, I didn't know a lot of people who had an RA diagnosis, and I was diagnosed with OA in my 30s. I didn't know anybody in my 30s who had OA, so I immediately turned to the internet looking for community. I needed somebody to talk to about what was going on besides my lovely doctors, but Connect groups were the first place I found some really helpful community, both with resources and educational components, but also just people who understood what I was going through. And like I said, we've got Connect groups based on your location, and some of these meet online, some people meet in person, some are a hybrid. And then we also have Connect groups for chronic pain, for specific diagnoses, for people who are newly diagnosed. We have all kinds of community groups. And like I said, if you're interested in cycling or even want to pop into our cycling group and see how that might be beneficial to your arthritis, we'll be talking kind of specifically about folks who are trying to find their place in cycling while also having an arthritis diagnosis. All right, so before we wrap up tonight, we'll have a few questions from the audience Q&A. So we've got one for Dr. Voos. Can you tell us your overall thoughts on supplements for arthritis?
The vast majority of supplements can be quite helpful. The main thing I tell people with supplements is you want to make sure they're from a reputable company and you know exactly what's in them. And there are things, some of the most basic things, calcium and vitamin D, magnesium, your multivitamins are things that are very important just at baseline. And there are all sorts of different supplements out there with HA and glucosamine and chondroitin and collagen and bone broth. And all of them have various potentials for help. There are not great studies to show the effects of those supplements other than with calcium and vitamin D, which have been shown to be very helpful. So I typically discuss with people if you have a reputable company that you're obtaining the supplements for, And it's part of that comprehensive program where I'm going to add these supplements to my diet and trial them for a certain length of time. I think that is very reasonable, and a lot of people get some relief from those supplements. And the challenge is each supplement has a different potential. One may just be adding protein to your diet or a vitamin or a mineral to your diet. Others may have some natural anti components. So I do suggest you discuss the supplements with your doctor, and in particular, if you're taking other medications, because some of these supplements can interact with your medication. So you want to make sure that you're utilizing those. So an option and part of the frontline treatment, again, you just want to understand what you're utilizing. And this is one where whether it's with your physician or with a nutritionist can really go through what you're looking for. The other part is, what type of symptom relief are you looking for? Is your joint aching? Is it swelling? Do you have inflammatory arthritis? And the different supplements may be helpful for each of those. So that's where meeting with a medical expert, such as a nutritionist or even your pharmacist, can help you decide which one is the best for you.
Great, thanks. We've got a question for Dr. Kelsey. If techniques have improved, why is patient satisfaction after knee replacement still relatively low?
I always tell patients that, it is not your normal joint, right? So I think a lot of it is the expectation going into it that it does improve your pain, it's going to improve your function, but it may feel different. You have to understand that it is metal and plastic, it's not your normal joint. I still think that the vast majority of patients do great with a knee replacement. They're very happy and really improve their mobility and their function and their pain. They're able to sleep at night. They're able to walk their dog. They're able to go on bike rides. But as I mentioned previously, there is that percentage of patients that just don't love a knee replacement. We don't entirely understand why. That number is in the 15 to maybe up to 20% of patients who get them. It's not that they fail, it's that they just don't love it, even when everything there is good. And so it just points to the importance of ways that we can mitigate the disease progression, ways we can slow it down and treat it early, other options short of a knee replacement if we can. And so it's obviously last sort of line option for patients. And that's why I really save it for patients who really feel like they're there and need it.
Very interesting. Back to Dr. Voos. We've got a question. Why might my rheumatologist not suggest any regenerative therapies as treatments?
That's a really great question, and one that comes up quite frequently. And when we boil back to the basics of regenerative medicine treatment, it's using your body's own cells and own growth factors to assist you. And in some inflammatory arthritis components, those cells may be turned on to make those cytokines or those signals that are inflammatory signals. So if you were to take those out of the body and concentrate or to multiply them, we could actually be multiplying those cells that are causing inflammation. So in our patients that may have a certain type of inflammatory arthritis, you really want to talk with your healthcare provider about what's safe or appropriate for you. And that may be something when those cells may be working against you than trying to help you. So it may be better off to consider things, whether it's the alternative type of injections like a lubricant injection or your steroid injections. And then there's obviously numerous different oral medications and injections that are the inflammatory modulating type medications. So we do want to be careful, and that's one of the things where there's a lot of room for research, is helping the body turn off that inflammatory process so we can help those cells go back to their baseline and use them to your advantage.
And finally, we have one more question for Dr. Kelsey. What made you go into the field of orthopedic surgery?
Oh, that's how long do we have to answer that one? So I'll keep it brief, but I think a little bit of it is a lot of orthopedic surgeons, we think we have engineering minds, so we think about things mechanically, and we want to think about how things work and move. And then I have a huge passion for the athlete and for mobility and for getting patients and individuals back to the things that they love to do and want to do. For me, I think the biggest thing that has made me very happy on a daily basis in my job and kind of keeps me going is the ability to help a patient get back to what they want to do and really have a true impact on their life. And you're not always just managing a chronic problem, but really trying to get them back and mobile and get them from a position where they're really in a bad way functionally or from a pain standpoint, and help them to get back to the things that make them them. And so for me, it was really a great way to combine, the engineering side of things, the biology. Both my parents are biology teachers, and sort of taught that, to me from an early age, the importance of the body, and essentially the ability for the body to heal itself, and to grow and to do pretty amazing things. And then from the sports standpoint, the mobility and keeping people on the field or on the pickleball court or walking their dog or getting up and going to work at the steel mill, whatever it is, really keeping people as active and mobile and happy as they can be. And mobility equals happiness. And so I really think that if you can keep patients moving, you can keep them happy.
Fantastic. Well, thank you as a patient and athlete. All right. So we're going to wrap it up in a minute here. If you find that you have some questions or concerns after we wrap up the webinar tonight, you can always reach the helpline on the arthritis.org website. You can email or call and talk to somebody about whatever concerns you have. We have a few upcoming webinars you might be interested in. On April 24th, we have Decoding Inflammatory Arthritis Meds and Labs. That's quite a learning curve. And May 22nd, we have Women's Health and Arthritis. You can always register for upcoming webinars on the website, arthritis.org. And we have some upcoming Connect groups that will be meeting virtually. We have chronic pain meeting at the end of March. We have the psoriatic arthritis group, and we have the newly diagnosed group meeting soon. And you can find all of the Connect groups. I think we're over 50 now at arthritis.org, also connectgroups.arthritis.org. And that's it. So I would like to thank Dr. Voos and Dr. Kelsey again for coming tonight. At least personally, I learned a lot. And it's really exciting as a patient to know that there's so much research and work going into helping patients. Thank you for everyone who attended tonight. Thank you for letting me be your moderator this evening. It's really exciting to be part of this process. And once again, there will be a survey going out. If you would please take a moment and fill out the survey so we can do things the same or better and know what you're interested in hearing about. And we hope to see you at our next webinar. And again, we'll be putting this up at arthritis.org webinars in a few days. Thanks, everyone.
Thank you for having us.
Thank you very much.